we're going to talk about parasympathetic and sympathetic interactions. We mentioned earlier how most visceral organs have dual innervation, so that action potentials continually fire down axons of both divisions, which produce what we call dynamic antagonism. And these work to precisely control visceral activity by opposing the activity of each other. Now, both autonomic divisions are partially active, which results in this basal sympathetic and parasympathetic tone. You can kind of think about these as pulling an organ in a different direction. Whereas, the sympathetic nervous system might want to speed your heart rate up, the parasympathetic nervous system can slow it down, and so your heart is sort of at this tug of war caught between the sympathetic and parasympathetic nervous system's effect on that organ. And ultimately, what determines the net effect on that organ is which division has the strongest effect. And that typically relates to the amount of tone there is. And by tone, we're referring to the frequency of action potentials. So if the parasympathetic nervous system, like the vagus nerve, has a higher frequency of action potentials going to the heart, you're going to see that the net effect of the heart is to slow the heart rate down. Now, one division usually predominates, but in few cases, divisions can actually have a cooperative effect, so they can actually help each other. So this dynamic antagonism allows for precise control of visceral activity. So sympathetic division increases heart rate and respiratory rate and inhibits digestion, whereas the parasympathetic nervous system decreases heart rate, respiratory rates, and allows for digestion and discarding and elimination of wastes. So these two oppose each other. In that sense, they're dynamically antagonistic. So almost all the blood vessels of your body are only innervated by sympathetic nerve fibers. So this division controls blood pressure even at rest. So what we refer to then is actually how your blood vessels have a sympathetic tone at rest that helps to maintain your resting blood pressure. And this is actually mediated by the brainstem. So the sympathetic tone or vasomotor tone is this continual state of partial constriction of all blood vessels. So if blood pressure drops, your sympathetic fibers fire faster than normal to increase constriction of blood vessels and cause your blood pressure to rise. And if blood pressure rises too high, your sympathetic nerve fibers can fire less, causing less constriction or dilation, and that leads to a decrease in blood pressure. So your sympathetic nervous system can maintain normal blood pressure by either firing more quickly to increase blood pressure or firing more slowly to decrease blood pressure through vasoconstriction and vasodilation. Now, the sympathetic nervous system also is able to shunt blood where needed. So you can shunt blood to skeletal muscle during the fight-or-flight response. The parasympathetic nervous system normally dominates heart and smooth muscle and digestive and urinary tract organs at rest. And it activates most glands except for the adrenal and sweat glands. It slows the heart and dictates normal activity, and these organs also exhibit parasympathetic tone where they're always slightly activated. So the sympathetic division can override these effects during times of stress. And drugs that block parasympathetic responses increase heart rate and cause fecal and urinary retention. So the adrenal medulla, sweat glands, erector pili muscles, kidneys, and almost all blood vessels receive only sympathetic fibers. And other unique functions of the sympathetic nervous system include things like thermoregulatory responses to heat, where when body temperature rises, your sympathetic nerves can dilate the blood vessels going to your skin, which can allow increase in blood flow to skin and your heat to dissipate away from your body, as well as activating sweat glands. And when body temperature drops, your blood vessels can constrict. So the release of renin from the kidneys is also a sympathetic effect, and so this occurs when your blood pressure is low. So your sympathetic nervous system can cause your kidneys to release a hormone renin that ultimately leads to the increase in blood pressure. And then on metabolism, your sympathetic nervous system increases metabolic rate, raises blood glucose, and mobilizes fat as a source of fuel for the rest of your cells. Now, your parasympathetic nervous system tends to elicit kind of short-lived and highly localized control over effector organs because acetylcholine is quickly destroyed by acetylcholinesterase. Now, your sympathetic nervous system has a tendency to have longer lasting and widespread effects. And the reason being is that norepinephrine and epinephrine come from the adrenal medulla. And it takes longer for these hormones to become inactivated, so they have longer lasting effects. And they're more widespread because these sympathetic hormones spread all throughout the body as a hormone through bloodstream rather than having localized effects from only being released by the nerve terminal, which is in the case of acetylcholine. So in terms of sympathetic and parasympathetic effects here, we can compare the two. So on your iris, which is the pigmented part of your eye, Your parasympathetic nervous system causes constriction of the pupillary muscles, which cause your pupil to constrict, and your sympathetic nervous system causes pupillary dilation. On the ciliary muscles of your eye, it actually stimulates your lens to bulge for close vision, and your sympathetic nervous system is causes your lens to flatten for distant vision. On your nasal, lacrimal, and gastric secretions and pancreas, this actually stimulates secretory activity. Your parasympathetic nervous system does, rather. And your sympathetic nervous system inhibits the secretory activities of nasal, lacrimal, gastric, and pancreatic secretions. That makes sense because you don't need to be making tears or mucus or releasing digestive juices while you're sympathetically active. And then on your salivary glands, obviously the parasympathetic nervous system helps to produce saliva, whereas the sympathetic nervous system actually prevents that. And in many cases actually stimulates the secretion of thick and viscous saliva. Now on sweat glands, your parasympathetic nervous system does not attach there actually. So sweat glands, your adrenal glands, erector pili, as well as coronary blood vessels, your parasympathetic nervous system has no innervation there. But your sympathetic nervous system does. So sympathetically, you can cause your sweat glands to increase their activity and your adrenal medulla to release epinephrine and norepinephrine. Your sympathetic nervous system is actually what causes contraction of erector pili to cause goosebumps. And on heart muscle, it actually increases the rate and force of heart muscle contraction. Now on your heart, your parasympathetic nervous system can decrease heart rate, but it has no major effect on heart muscle contraction. Sympathetically, you can increase heart rate and increase the force of muscle contractions of your heart. Now, on your urinary bladder and urethra, the parasympathetic nervous system causes urethral sphincter relaxation and contraction of the bladder, which helps to promote voiding or urination. And sympathetically, it actually causes constriction of the sphincter and inhibits the bladder contraction, which actually inhibits urination or voiding. On your lungs, the parasympathetic nervous system causes bronchoconstriction to limit airflow, and your sympathetic nervous system causes bronchodilation to increase airflow. On your digestive tract, your parasympathetic nervous system actually increases peristalsis or smooth muscle contractions. It relaxes sphincters to allow for digestive contents to move through the tract. And your sympathetic nervous system is the opposite here, where you can decrease the activity of glands and muscles of your digestive system and constrict sphincters to prevent the movement of materials in your digestive tract. Your parasympathetic nervous system can increase glucose uptake from blood, so it actually lowers blood sugar. It helps to store that for later use in your liver. And then your sympathetic nervous system actually stimulates the release of glucose into blood. That way you can increase blood sugar for utilization by your body's cells during the fight or flight response. Parasympathetically, your gallbladder becomes more active in response to an increase in your parasympathetic nervous system, whereas the sympathetic nervous system inhibits gallbladder secretions because this is involved with digestion. Your parasympathetic nervous system actually has no effect on the kidneys, but your sympathetic nervous system can cause renin release, which increases blood pressure, and also causes vasoconstriction, which decreases urine output. On your penis, your parasympathetic nervous system causes an erection. Same with the vagina and clitoris. It actually causes an increase in vaginal lubrication and erection of the clitoris. Sympathetically, your sympathetic nervous system causes ejaculation and also causes the vagina to contract. So remember, sympathetic nervous system is more involved with sexual climax, whereas the parasympathetic nervous system is more involved with sexual excitement. On blood vessels, your parasympathetic nervous system has little to no effect, whereas pretty much most blood vessels of your body get sympathetic tone to help regulate blood flow and blood pressure. Parasympathetically, you have no effect on coagulation, metabolism, or adipose. However, the sympathetic nervous system can increase your coagulability of blood, which makes sense because you want to be able to clot during the fight or flight response. Your sympathetic nervous system can increase metabolic rate. It can also stimulate lipolysis by acting on beta-3 receptors for fat breakdown and an increase in free fatty acids within your bloodstream during the fight or flight response.